further delay, I'm going to welcome Dr. Julia Herman. Thank you for joining us. I know it's late where you're at, so I appreciate you taking the time to come and speak with us tonight. And I'm going to hand the screen over to you.
Thank you, Mele. Good evening, everybody. I almost said good morning. My name is Julia Herman, and I'll give you a little bit of introduction about me. But I get to work with Mele and all of our state BQA coordinators from across the country. I am currently in Tucson, Arizona, so it's not that late. It'll be fine. But I think this is a really great topic to talk with producers because well, I think we have certain definitions of what weaning and preconditioning are. They are still very adaptable to whatever your operation is. And I hope to kind of spur some ideas within each of you on how you can, uh, BQA is all about continuous improvement. So what are these little things that you can do to improve in your practices in the weaning and preconditioning space to improve the health of your animals and welfare of your animals, but also that ends up I mean, cattle are worth a lot of money right now. And so every little bit that we can take care of these animals is going to help with that business sustainability in the future too. I am one of the veterinarians at NCBA, and I'm on the producer education team. And so I lead education development and veterinary outreach for producer education. And a lot of these are uh, a lot of these events are towards cattle producers like yourselves, also to veterinary organizations and universities and vet schools. So really, a lot of different audiences that I get to reach out to. I am born and raised in Colorado. I have a wildlife background prior to getting to vet school. After vet school, I went into private practice in Kansas, primarily cow-calf, and then I returned to Colorado State University for to teach at the vet school. And then I joined NCBA about 6 years ago. So I've had private practice, academia, and industry all of my career. I am married to a fourth generation wheat farmer. He's currently, well, I guess they're in the middle of corn picking, but he loves all things ag. So one of these days when we come out and see you, we're going to see all of your agriculture. I do want to first off say a special thanks to a number of veterinarians who I was like, hey, I'm giving this talk on weaning and preconditioning. What are your tips? And so many of you probably know Tim Richards. I actually saw him at a meeting today. He gave me some tips. Um, and we have veterinarians from Washington, Virginia, Tennessee, Kansas, and Nebraska, all that contributed to this presentation. So lesson number one, ask your network for, I mean, you can take pieces from all your friends and all your colleagues and try to change what you want to do. So ask your friends. I'm going to start off with beef quality assurance, our mission statement. So it's to guide producers towards continuous improvement using science-based production practices that assure cattle well-being, beef quality, and safety. And I hope you see that throughout the presentation. I want to point you to more resources beyond this webinar that producer education has. And so one of the main things beyond BQA and BQA transportation is our Cattlemen's webinar series, which is on YouTube. I actually went and I just searched weaning and preconditioning, and there's quite a few video clips and different things that you can go look at. And if anybody's able to come to Cattlemen's College at our convention, we tend to have some weaning and preconditioning, and I mean nutrition, all these different types of webinars that you can take part in, and it's all free. So take advantage of those. And shameless plug, since Mele's on here too. If you aren't BQA certified, I hope you will be soon. I know she's doing trainings, and then we also have some online trainings that you can check out in all your free time, since we all have a lot of free time, as it turns out. This, if you guys, well, I don't know if you even know this, Mele. Our BQA transportation modules, it just got translated into Spanish, and those are now live. And so we're really excited about all of these being in both English and Spanish, if that applies to any of you. So a lot of the information I have here beyond from my cohort of friends came from our new BQA national manual. Our national manual gets updated every few years, and this just went through an overhaul last year. And so a lot of the information is going to be from that. You can go download that on our BQA website, and you can also download our new field guide. And those are both handy references for you if you're looking to, looking at facility design or biosecurity tips or anything like that. They do have an interactive PDF, and so you can go through that and click on the chapter and go to that exact chapter on your computer. You can do it on your phone. It's just it's just a lot of information to look on your phone, but please go check those out. BQA covers a number of topics, and I think I think you'll see that as we're talking about all of the stuff that we are going to talk about with weaning and preconditioning. But what BQA is, it's really a total quality management program. So it's not just one piece of taking care of cattle. It's looking at animal health and well-being from a number of different ways. And so that's nutrition, it's biosecurity, it's low stress handling. But all of these really important steps that you do on a daily basis go towards animal health and well-being, but it also is the performance and whatever product that you are providing or producing. All of those actions play into that, and every member of the production team, part of total quality management is every member of that production team is committed to those high quality standards, and that's something that we try to encourage in all of our BQA teachings. All of this starts with that veterinarian client patient relationship, so that VCPR, reminding everyone that it's an agreement between you and the veterinarian. It's renewed and updated annually, but this allows that veterinarian to come onto your farm and diagnose animals, issue health certificates, and also do a lot of, if you need treatments, it's required for all those prescription, extra label or off label use, and FDA feed medications that require veterinary feed directives. So the veterinarian is key to a lot of these things that you're doing on the ranch. This is a working relationship with the veterinarian. It's not just you sign the piece of paper and walk away. But I encourage you to talk to your veterinarian about working with, not just on herd health plans, but nutrition, biosecurity, emergency action planning. There's a lot of different ways that you can use your veterinarian. Training is a huge piece that you could be using a veterinarian for. So worker safety is key. And I started off with that because I told you I'm married to a farmer and I throw him under the bus a lot. So I'm going to do that right now. But we in agriculture are very bad about taking care of ourselves. And my husband generally has at least one blue finger because he smashed it somehow because he was, hitting some sort of equipment without paying attention to where his hand was. When we're in the animal realm, zoonotic disease is one piece to that. And so, are we doing a good job of protecting ourselves from zoonotic diseases and other things within our industry that could be dangerous? So use your veterinarian in a lot of these training opportunities also. Safety is key on beef production operations. I think you all understand that. Sometimes I think we take it for granted, maybe. But that safety culture starts with the leadership and includes everybody on the farm, not just workers, but it's family members, it's people who are visiting. We need to make sure that they know what is allowed, what isn't allowed on your operation. Provide personal protective equipment if need be. So is that boot covers, or are you doing a boot wash? Maybe you just ask them to wear clean clothes and shower before they come over if you know that they had traveled internationally, for instance, or something like that. But agriculture has one of the highest workplace fatality rates, and that means prevention is really key. So I just remind everybody to think about that on a daily basis, even though sometimes we don't. Communication is not just for training. Well, it is for training, but it's for those everyday activities to make sure things are getting done the way that the operation wants them to. But it could also include animal handling, including horses, firearm or captive bolt safety and maintenance, gate safety, manure and commodity storage. There's a lot of different communication aspects of safety that we need to incorporate into our everyday practice. But just a reminder that we all are in a dangerous industry, and I want you guys to be safe. Okay, we'll move into the crust, the what we were planning on talking about. So, importance of weaning. Why why health matters at weaning is for a number of different reasons. And if you can see this, factors affecting the bovine immune response, it's not just it's not just nutrition, it's not just weather, it's all of these different things. So it's commingling, antibiotics and vaccination, disease and pathogen exposure, genetics plays a huge role, environment and housing, age, weaning, dietary changes. And transportation is one that obviously I think a lot of people think about stress with weaning, but when we have a stressed immune system, and us, I mean, we can apply this to humans, right? When you're super stressed, that tends to be when that cold or respiratory virus shows up. Same thing with cattle. But when we're looking at signs of stress with cattle, maybe they're walking the fence line, maybe they're bawling, they're not eating as much. There's some signs that you can see where they're not doing as well as they should be. And knowing when to see or knowing what to do when you see those signs is really important. The number one goal with our cattle at all times, but especially when we're about to wean our calves, is minimizing stress. You're never going to get to zero stress. I say this with biosecurity. Biosecurity, there's no such thing as zero risk, but you can mitigate risk with a lot of small steps. Same thing with stress. No such thing as zero stress, but you can mitigate that stress through a number of the things we're going to talk about. So that's nutritional management, low stress weaning options, processing in a good way, handling products well, parasite control, environmental stress, minimizing that, and then improving our herd health plans as much as we can. So all of these, not one of these is more important than the other, but when you add them all together, that's how you build up that protection. So when in that calf's life are we trying to prevent problems? I borrowed this from John Curran, who's my coordinator or our coordinator in Virginia. But when that calf is born, there's a few different major activities that happen in its life before it gets marketed or transported. So we generally have branding or processing. I should say processing plus or minus branding. I don't know. Does everybody brand in Hawaii, Melly?
Yeah, most do. Yes.
Okay,
It is a
okay,
requirement of the state.
okay, okay. Then we have weaning, and then we have marketing. So if you were in a class, I would ask you, where along this timeline are we trying to prevent problems? The reality is all of it. But for this specific talk, it's mostly that post-weaning stress we're trying to minimize, but also that post-marketing or transport stress that we're trying to minimize. And a lot of that takes planning way before even, I mean, I'm only going to go back to calving, but it can go back even farther because the way that you take care of your cows has long-term effects on how those calves respond to stress. But I don't have time to go into that. So we're going to focus on the calf. So I stole this from my biosecurity presentation, but it's all about what you can control. And there's a lot of things in caring for your calves and deciding those weaning and preconditioning steps you can control. Okay. I'm going to start with behavior and facilities. Behavior and facilities was the one thing that my brain trust told me that this is something that we can always improve. There's always something we can do a little bit better with understanding cattle behavior, stockmanship, and facilities. We talk about cattle behavior as using those innate cattle instincts and sensory perceptions and experiences to use the natural cattle behavior to direct them in ways that you want them to go. When you provide that training to personnel to be able to be comfortable handling those cattle and properly handle those cattle, that lowers the stress of those animals every time they're handled. And you can train them like the way that we train, I guess, I think about dogs, like the earlier you start training them, the easier well, theoretically, I had a Jack Russell. It didn't work that way, but theoretically, the earlier you start training them or getting them used to different situations, the less stress they're going to have later when they get exposed to that again. And facility design is really important, not just for the animal, but for the human counterpart too. We want to keep our humans safe when we're handling our animals. So I put this up here. If you go to the National BQA YouTube page, there's actually a playlist of cattle behavior and handling, and there's lots of different videos. And you can see the top three videos are cattle handling on foot, cattle handling on horseback, cattle handling on ATV. So whichever tool you decide to use, we've got a video where you can go and learn from Kurt Pate, and then Ron Gill's got a lot of videos on here too. But I guess challenge yourself to, you know, I have to challenge myself to be more patient when I'm handling cattle. So I guess I'm going to challenge you guys to do the same thing. Again, handler and animal safety, but one of the most effective ways that we can improve animal welfare as cattle producers and veterinarians is improving how we handle them and improving our stockmanship. We can always get better. Even Ron, when he goes out and practices with his heifers, and he's out there all the time. He's a world-renowned expert, and he's still out there practicing. So I think we can all learn from that. Temperament of cattle and people is something to pay attention to when you're handling cattle. If a person is getting stressed, it's going to show in how the cattle are being handled. And as the veterinarian who has been behind the cows who have been pushed a little hard through the chute, I can tell you that my shoulder knows when those animals are being handled well or not. So make sure that if our people are getting overworked or overstressed, maybe we need to give them a break or send them to do another role on the farm, or at least in the processing day. I say training, you're going to hear me say training a lot today, because that's one thing we can control. We can control how we train our people, but also understand the application of pressure to direct cattle. So that comes with that understanding cattle behavior and knowing where to move those animals, where to put that pressure, so that we can efficiently and safely move our animals. With facilities, there's a lot of different layouts, and I'm not going to tell you one is better than the other. Each operation is going to do it differently. And as long as you train your people, any facility will work. But make sure that you design these in a way that decreases stress. So watch your footing, do a facility walkthrough before the cattle are in the facility. That's probably one of my biggest tips when you're doing a processing day. But consider acclimating those calves to the facilities before processing day. And this is also it'll play into the two-step weaning that I'm going to talk about in a while. But what the thought is with acclimating to facilities is, so in this particular picture, which is just one I found on the internet, the day before processing, what people would do is you would bring your calves and your cows in. You would separate your calves, put them in this pen, and you would keep this chute open. And those calves, they can see their moms, but they have to figure out to go through the system to get back to their moms overnight. And what that does is, one, it lets the calves know that they can be away from their mom for a little bit, and it actually decrease the stress at weaning. But it also helps them walk through that facility once, and it makes them think that nothing bad is going to happen to them in that facility. So when you separate them again and put them through the chute, they actually go through the facility a lot easier. And so that's one way of training those calves, but also it has secondary benefits of helping with weaning down the road. So I don't know if any of you have tried that, but that's something I learned from Tom Knopfsinger in Nebraska. With branding, I think there's some different ways. I don't know, I think there are a lot of people who see branding and they think that it can be really high stress, and it certainly can be, but there are some ways that you can make it really low, you can make it lower stress. And as calm as possible is how I try to teach people, but the slower that you're moving those animals, like the horses, and dragging those animals, you're going to reduce that dust and reduce that pneumonia risk. And then I also encourage, decreasing noise as much as possible. Some options, depending on how you're set up, some people will separate the cows from the calves, and then return the calves to the cows after processing. Other people will keep them in the same pen and just pull the calves off one at a time. And so I think that I don't know if we have honestly, any research to say one is better than the other. I think you can do either well. You just have to be calm and make sure you're taking your time and keeping those calves welfare top of mind. Again, train your team. Ensure the person vaccinating is trained on how to take care of that vaccine. Because if they're not taking care of that vaccine, it doesn't matter if it gets in the calf or not. It's not going to be effective. And then make sure they're keeping that product cool and out of the sun. So, uh, and I guess I'm going to remind people that this is not a practice day. I have some friends who think that branding is, oh, I only rope once a year and it's at the branding and I'm going to come practice. That's not the time to practice. Those calves are already going to be stressed. You don't want to add more onto them because that's going to affect them for the foreseeable future, if not the rest of their life. Handling tools are an extension of your arm, and that's all they are. Reminding people that, I honestly prefer not to have a handling tool in my hand. I just use my arms, but non-electric handling tools like a flag or a paddle, you can use those to make yourselves appear bigger and to apply more pressure to a group or an individual animal to try to help move them. Uh, Electric prods, these are tools that are good in very specific situations, but they should not be the first tool that you go to when you're moving animals. Using dogs, make sure your dogs are trained appropriately. I've been around some really good cattle dogs, and I've been around some really bad cattle dogs. So if they are not doing what they're supposed to, they just need to be removed from the situation because again, it's stressing the animals, but it also can turn into something bad for the people. All right. Uh, if any of you have heard me talk before, I can talk on biosecurity for days, but I won't do that to you. But biosecurity is very important, especially in our calves. So I do encourage you to walk through your operation we do have a daily biosecurity plan that BQA has, but walk through the different risks that might be coming on or off your operation, what your cattle might be exposed to, and then try to think about some practical steps that we can do to decrease that risk. Using different principles. So exclusion, very difficult to do in the cattle industry. This is sort of what the commercial poultry and commercial swine operations are trying to get to. So they control the environment, they control, traffic in and out of the operation, everything like that. Again, very difficult to do in the cattle industry. But separation, these are steps that I think you all will recognize. So having physical separation, so like walls or distance in between animals, or groups of animals, time between visits. So we recommend a quarantine period for incoming animals of 30 days, 21 to 30 days. What that does is it provides enough time for any viruses to get through the system, but also enough time for you to test for incoming diseases if you choose to do so. And then procedural, this might be the easiest one to do, like have clean clothing or clean footwear. I honestly, I travel a lot for my job, and I'm on different operations in different states. I carry booties in my suitcase, and so if I go to an operation, I'm going to have clean shoes when I get on there because I don't want to take anything to them. I also don't want to take anything back. So cleaning and disinfection, super important, making sure we're getting all that organic matter off, because if you leave organic matter on and you put your disinfectant on, it's going to inactivate it. So just make sure we're doing these basic steps correctly as we're going through the process. There are different routes of transmission and prevention steps that you can look at in both our field guide and our manual. If any of you, I know there's not a lot of dairy in Hawaii, but if you are interested, the National Dairy Farm Program has a great biosecurity manual too. But adapting each biosecurity plan to each operation is really important. But there are some overall things that we can all do. So handle healthy animals before your sick ones. You don't want to take those germs from the sick animals to your healthy animals. isolation and quarantine guidance. If you have a quarantine area for your new incoming animals, use it for isolation if you have sick animals. Again, training and education. Make sure that you have those health certificates for all interstate and some intrastate movements. I know, I mean, I guess I should have said inter-island movements. Testing for disease on those incoming animals if possible, or if you're interested. Record keeping is very important. This is not just, I mean, animal health is the number one thing that I think about. This is, you know, you're looking at treatment, you're looking at withdrawal times, you're looking at vaccine records. But if you have a specific marketing program that you are a part of that requires record keeping, this is the way that they verify that you're doing what you need to do in the marketing, in that marketing program. So record keeping is very important. I just learned that you should be keeping your medical records on your animals for 5 years, because if you get like a residue violation or something like that, it might take that long for the investigation to go through. And so having records to prove that you did things okay is important. So keep your records for a long time is what I guess I'm saying. Health products, feed records, chemical and pesticide records, and then training records. If you notice in our manual and our field guide, when you download those, we actually have a record keeping icon, this little icon, all throughout the book or all the manual to give you some guidance on what records you could be keeping. Okay, planning ahead. So calf health, I showed you that calendar where we start at calving and we go all the way to the marketing. That's, I mean, that's kind of, I mean, to me, it's kind of exciting, but it's also a challenge when you have to plan that far ahead. And I'm going to hopefully show you why that's important. So calf management, the calves' immune systems really don't develop until they're 5 to 8 months old. And that's because, well, I mean, that's part of how they develop, but that's why colostrum is so important when those calves are born. So colostrum is that first milk, and what that does is it has maternal antibodies. So whatever that mom is protected from, she puts that into the colostrum, and then the calf consumes that and passively takes in some of that immunity. But that maternal antibody declines by the time that branding comes along, so around that 2 to 4 months of age. Calf immunity can be impacted by a number of things. A lot of it comes down to biosecurity and environmental management. So clean calving area, providing that colostrum within that first 6 hours. And then if you have to supplement any of your calves, make sure that your product that you're using is it's a replacer and not a supplement. I will also say read the label about 1,000 times today. So read the label, but your replacer is going to be more important for replacing the colostrum because it's going to have a higher amount of those antibodies. So that 200 grams of immunoglobulin or IgG. Just work with your veterinarian if you're unsure of what product to use, but replacer is generally better than a supplement, at least at first. And then individually identifying these animals to make sure you're treating them and then following up with them too. Clean pastures. So calving in a clean environment is important. We already talked about the immune system of these calves takes a while to develop. And basically the way that we keep our calves healthy is to minimize as many pathogens or germs that they are exposed to as possible. A lot of this comes from the environment. You can't prevent all of it because calves and cows, they mouth everything. But what are some ways that you can try to do that during calving season? So if you have shelters, those can be moved several times during calving season. Basically, you're moving it to a fresh plot of land that has not had poop on it. Feed in different areas, minimize the contamination of resting areas, so like under trees or near waterers. Bedding has a question mark because sometimes bedding helps and sometimes bedding makes it worse. So I guess I'll let you guys decide that. older calves will spread pathogens to young newborn calves, so you need to separate them. And one of the examples is this Sandhills calving system. And it was developed in the Sandhills, but you can apply it. I mean, you can apply it anywhere. It's not just Sandhills. So the idea is you're basically rotating pastures with your pregnant animals. And so here on this bottom picture, all of your animals, all your pregnant animals are in the first lot. And about every 2 weeks or less, you could probably do 10 days to 14 days, you basically move your pregnant cows to a clean lot. And so your older calves stay here and they poop and spread germs all just within the same age group. And then these newborn calves are not exposed to all of those pathogens. So that decreases your risk of scours, and eventually there's a waterfall effect where it can decrease your risk of pneumonia in a lot of those calves. But you don't have to have a huge area for this. It's just as long as you're moving those pregnant animals into a new area. But the big thing is you want to reduce the exposure of those newborn calves to any of those pathogens. Calf scours is a big deal, and that's what you're really trying to prevent in these first couple weeks of life. That's any of our agents: E. coli, Salmonella, Rotocoronavirus, Coccidia, Crypto is also in here. But it's direct contact and ingestion, and so it's poop. So you want to minimize the poop that these calves are exposed to. Prevention, make that colostrum is really important from the antibody standpoint, but also nutrition standpoint. Minimize overcrowding. The more you increase stocking density in any age of animal, the higher stress you're going to have. Sanitation, we've talked about that a lot. Isolate your affected calves. If you have scouring calves, you want to separate them from your healthy calves. You don't want all the calves to start scouring. And a big thing is vaccinating that dam 45 to 60 days prior to calving, because then she can when she gets vaccinated and starts developing antibodies to the vaccine, those antibodies will go into the colostrum. So when we evaluate calf illness, we want to understand what illnesses the operation is at risk for, but also it's that prevention piece. And so vaccination, clean environment, prompt treatment, isolating sick animals, but you really have to look at the entire system to understand why calf illness is happening. I put these, University of Wisconsin-Madison and UC Davis have these calf scoring apps. And yes, they are dairy calves, but you can still use them for beef calves. But if you want something to help with just giving some objective ways to say this is a sick calf or this is not a sick calf, these are cool tools. But calves sick within the first 60 days of life, this will affect lifelong productivity. We see that the dairy industry has shown that a lot. So any of your calves that are treated for pneumonia or scours in that first 60 days of life, it significantly impacts how much milk they give over their lifetime. And so it's the same in beef cattle, but obviously just not milk. It's productivity overall. So we really want to take care of these calves in those first 2 months of life as much as we can. The calf's immune system is a little bit complex. So here is the birth. So we get that passive immunity. This passive immunity is black. So that's from that colostrum. And you can see that for that first couple of months, we've got some pretty decent immunity if that mom has put her immunity into that colostrum and the calf has received enough colostrum. So there's some factors there. But as that maternal antibodies or immunity wears off, that animal becomes more susceptible. It becomes more susceptible, but their immune system is also developing at the same time. And so there's specific time frames where vaccination actually is timed so that we are taking advantage of one, the maternal antibodies going down, but also their immune system ramping up so they can respond to the vaccines that we're giving them. Immune system is affected by a number of things. And again, you could apply this to humans too. So things that help your immune system: quality nutrition, clean environment, vaccination. maturity. So the older our calves get, the stronger their immune systems are going to be. What hurts them? Stress. What causes stress? Everything. Weaning is the most stressful time in a calf's life. Changes in feed can be stressful, extreme weather, management practices like castration and dehorning, transportation, commingling or mixing groups of cattle. A lot of things can cause stress, but again, we can mitigate some of this stress. Even if we have to wean, even if we have to mix a group of cattle, there are ways that we can mitigate some of that stress. The goal is to reduce the compounding stressors. So in the red, this is the disease challenge, and then the purple is our immunity. So you can see that once that animal is vaccinated, their immune system goes up a little bit, and their immune system develops antibodies. But the more that you stress that immune system, even those antibodies, if they're built, or that immune system will still get challenged and it'll weaken. If that immune system weakens due to weaning, shipping, commingling, changing feed, any of those stressors we talked about, that disease challenge increases, and it makes it more of a chance that we're going to get sick, or the calves are going to get sick. So with animal health products and processing, I mentioned this earlier, so we have to take care of our products, or else they're like, if we don't take care of our products, if we put them in the animal, it's not going to do anything. So we want to make sure that we're taking care of a lot of our products. Come on. Okay. So proper handling and storage. You guys live in a humid, hot environment. We need to make sure that we're taking care of these following storage temperature guidelines, proper record keeping and handling of these animal health products, maintaining that cold chain. And so what we mean by that is even from where you buy that vaccine or antibiotic or dewormer, we want to make sure those products are being taken care of all the way to your operation and where you put your fridge in, or what you put into your fridge, but also make sure your fridge is functional. And I have a couple slides about that. But protect products from extreme hot or cold temperatures and also sunlight. When we hit those extreme temperatures, the products break down and they can actually become toxic to animals. So like if you freeze a killed vaccine, for instance, it can actually create a lot of toxins. And if you inject that into an animal, it can send the animal into anaphylactic shock and kill it. So like it's very important that we protect our products from all of these different extremes. Never mix two antibiotics, two vaccines, other products in one syringe. They inactivate each other. It can cause an abscess, and you've just put a lot of money into products that are not going to work. So never mix anything, and always read the label before using that product. When we're mixing and drawing up vaccines, very similar tips. So keep things out of the sunlight as much, or protected from sunlight as much as we can. Label syringes with the product that you're putting into it, because if you mix products, again, it'll inactivate them. And then make sure you're using clean or sterile syringes and needles. Transfer needles are what we have right here. Those can be, if you decide to use those for vaccines, make sure that they're clean. I also label those for each vaccine, because if you say you use it for a respiratory vaccine and then you use it for a Bangs vaccine, those vaccines can actually inactivate each other too. So I use one transfer needle per type of vaccine that I'm mixing up. Only clean needles should enter a product, and that's any of our products. So vaccines, antibiotics, dewormers, lidocaine, clean needles only into the bottle, because you don't want those to be contaminated. It's not recommended to use disinfectants or soaps for cleaning syringes or needles, because that can also inactivate any of the products. A reminder of injection sites. Injecting in the neck is what BQA recommends, so that we're protecting all of these high value cuts from getting injection site lesions. The borders of our injection sites, below the nuchal ligament or the neck, this is that really thick neck ligament on our animals, in front of the slope of the shoulder, and then above that neck vertebrae. Remember that you have two sides to the neck, and I do a hand's breadth. I know everybody has different size hands, so about 4 inches apart. What happens is if you put injections too close together, is those they can mix under the skin or in the muscle, and again, they will inactivate each other, or they could be caustic to each other and cause irritation. This is the result of injection site lesions, and so this is what we're trying to prevent. Um, well, so this bottom right is it's an injection site wet lab that I did when I was in vet school. But we did res floor in the back thigh of this animal, and you can see this really ugly abscess. And all I think about is like, this is in the round. I guess I said the thigh, but I mean, if you had a roast that you made and you cut it open and you saw that, would you want to eat that? No, none of us want to eat that. This is an old injection site lesion. You can see the greenish tint. This really dark red one is intramuscular flunixin meglumine or Banamine. Banamine or flunixin meglumine, the injectable kind, the only way that it is labeled for use in cattle is IV, so in the vein. This is why it is super caustic. It's super painful if you give it sub-Q or IM. It also increases the withdrawal time to over 30 days. So always follow the label. And if you don't feel comfortable giving an IV injection of Banamine, have somebody teach you. This is from Dr. Tarpoff at K-State. This is actually, so you can see this is the tail head. This is a abscess from somebody giving an injection in the hip of an animal. And so this abscess goes from the top of the tail, well, like at the base of the tail, clear down, almost going into the thigh. So this is like, if this was going into a packing plant, this entire thing would get cut out and just thrown away because we wouldn't be able to use it for anything. So always keep your injections in the neck. Management and animal welfare, pain management and animal welfare should be considered at all stages of cattle production. I have a lot of things on my list that I consider pain management for. So castration and disbudding or dehorning is one of the main things that we think about, but lameness, calving, mastitis, foot issues, eye infections, all of those are painful. So there's a lot of different, there's a lot of different formulations of flunixin on the market now, and I have a slide about that in a minute, but there's also some off-label medications that veterinarians can prescribe for you as long as they have a VCPR with you. But we can talk about that in a minute. But if you do get any of these pain medications that are prescribed extra label, you have to follow the extended withdrawal times because and maintain records of animals that are being treated. So just work with your veterinarian on that. Castration, dehorning, and tail docking. BQA, well, castration, it depends on how old they are when you get them castrated. BQA recommends that this be done at the youngest possible age, so 0 to 3 months, or at the first handling, depending on how your system is set up. Dehorning can be more stressful than castration, and we recommend the same time frame for that. But routine tail docking is not recommended. That's not something that's more from the dairy industry, but we added in here too. But all of these procedures are painful, no matter how big the animal is. From a day-old animal to a five-year-old animal, all of these procedures are painful. There are different ways that we can provide pain management and do these painful procedures in a less painful way, and we should try to do that. These are the different flunixin formulations. So we have the injectable that we've talked about. Some of you may have used the transdermal, which is the topical one. And then there's an antibiotic combo where flunixin is in the antibiotic. So there are different ways that you can get this. It's anti-inflammatory properties on board. Meloxicam is something you have to have a VCPR in because it's extra label drug use, but it's very effective in our ruminants. And these are little tablets. It's actually a human medication. And the tablets, what if you once you get it up to whatever weight that animal is, it can provide up to 36 to 48 hours of pain relief with one dose. And it's incredibly cheap. So talk to your veterinarian about that, see if that might be something that you could work into your system. Lidocaine is also something to work with your veterinarian on. There's a lot of different uses that we can use lidocaine. It works right away, and but it only has a short duration of action. So it's really good for things like um, castration, epidurals. I think it's essential for dehorning anytime, any size that you're doing. But lameness exams, there's also a new castration band that's been developed that has lidocaine impregnated into the castration band. And I've heard like some people love them and some people think that they're okay. So I don't know. But I'm going to show you this video. So this is a video from one of my colleagues, and you can see that we're putting lidocaine into that spermatic cord. Um, and you can see right here that right testicle has already dropped. So that lidocaine is already working. And so this is something that, again, talk to your veterinarians about. Maybe this is something that you can incorporate, especially with, well, if bulls are any bigger than I'd say like 300 or 400 pounds, you probably need to be having a veterinarian involved anyway, because that's going to be pretty painful once they start getting that big. Catching illness early is super important. This makes it so that you have a more successful treatment. We talked about training the team to recognize signs of illness. Different signs. It depends on the illness, but most of the time it's, they're going off feed, their ears are droopy, they might be dehydrated, and when they get dehydrated, that eyeball kind of sinks into their socket. Um, Maybe they're isolating themselves, not staying up with the group. There's a few different ways that we can find this, but develop treatment protocols to follow. If you and your team have a treatment protocol to follow, it makes it I don't want to say you don't have to think so hard, but you know what to recognize when you have these treatment protocols. Follow label instructions on all the antimicrobials and medications that you might need, and then allow it to work. And what I mean by that is if you have an animal that say you gave an antibiotic to 2 days ago, it probably needs more time before you give it another antibiotic. And so we call that retreatment time. Just make sure you're giving that treatment enough time to work. Recheck the animal. This is something that I know that I could have done better when I was in practice, but once you treat an animal, go back a couple days later and make sure that that animal is improving or not improving. Sometimes we treat animals and never see them again, and sometimes that's unavoidable. But if you can recheck an animal that you know that you treated, that helps to know that you treated the right thing. Call a veterinarian sooner than later. Earlier in the disease, we have more success. And then if you do happen to have animals die, you can get trained on how to do a necropsy and talk to your veterinarian, but some veterinarians will take pictures from necropsies, and that helps figure out what that animal might have died from to prevent that from happening in the future. I put this in here. This is in both our manual and our field guide, but this is our beef producer's guide for judicious use of antibiotics in cattle. And these are just tips on how to make good decisions and judicious, responsible decisions on how we're using antibiotics. Antibiotic resistance and antimicrobial resistance, so or dewormer resistance, is a real thing in the livestock industry, and it's also a One Health issue, which means that if we see resistance to these medications in the animal industry, it can also affect resistance in the human industry. And so I encourage you all to go look at these and make sure that you're taking these into account when you're deciding if an animal needs to be treated. With processing, it kind of depends on how much, I guess, if you're going through a chute system, if you're doing a branding, but uh, the product handling and storage it remains the same regardless of how you're processing those animals. Um, Implant administration, I have a couple slides on that if anybody is implanting their animals, and then making sure we're cleaning and sanitizing your syringe systems in between. I'm going to from a human safety standpoint, again, we have a one-handed injection technique on the top here, and then a two-handed injection technique. Use uh, My bias is towards the one-handed technique because I don't want my hand to get smashed. A lot of that depends on the facilities you have. I've worked with some facilities where my hand was going to get smashed no matter what I did, but use the one that you are most comfortable with. But with the two-handed technique, just make sure that if the animal is jumping, the two-handed technique, sometimes you have a higher risk of stabbing yourself. And as somebody who has done that multiple times, I don't recommend it. This is a label reading exercise. Again, if I had you in person, I would test you. But the label on all of our animal health products has a lot of great information, and I encourage you to read the label. I have I'll give you a mistake that I did, it, and I just so you can learn from my mistake. I was vaccinating some dairy heifers with a Clostridial vaccine, and I got through all of them. I was like, wow, we have a lot of vaccine left. And my dairy manager comes over to me and he's like, you gave the sheep dose. And so I was giving a 2 ml dose instead of a 5 ml dose. And so uh, learn from my mistakes, read the label, and make sure you're giving the right dose and the right route of administration to whatever animal you're giving it to. Also, pay attention to the residue and withdrawal times on those labels. With needle sizes, it changes based on the type of product you're giving, but also the thickness of the skin. And so, your weaning age animals, honestly, probably a 18 gauge or a 16 gauge is what is going to be good enough for you. Uh, Changing your needles every 10 to 15 head at a minimum. If you are worried about diseases that can be spread via the blood, so that's something like anaplasmosis, Johne's, bovine leukemia virus. Those are the only things I can think of right now. Change your needle every head. Needles are cheap. Diseases that are spread via blood or bent or broke needle because you used it on 300 head. That doesn't make any sense. Our cattle are too precious for that, especially right now. Just use a new needle. Protect your hands from needle sticks. With your animal health products, I encourage you to take write down inventory information. And so that's like what's the product name? When did you receive it? What is the lot number? In case there's a reaction or some sort of question, you have all that information. We also recommend that you do a health product temperature log for any of your refrigerators. There's a number of studies out there where, like those little beer fridges, never, ever, ever use those for a vaccine fridge. They do not keep things consistently cold very well. Use a real fridge. I'm also going to encourage you to, if you have the fridge that's retired from the house that's now in the barn, please get a new fridge. If that fridge was not keeping your food cold, it's not going to keep your vaccines cold. So, and then if you're out processing, make sure you're protecting those vaccines. So a lot of people will use these. You can turn a plastic cooler into a vaccine fridge. I tell my veterinary friends that, I mean, they have 1,000 styrofoam coolers. So if you need one, ask your veterinarian. So vaccination overviews. The principle of vaccination is we're trying to minimize that risk of severe disease. We're training that immune system for whatever pathogen we're paying attention to, but don't assume that just because you gave a vaccine that you're going to get 100% protection. It does take time to build that immunity, and the mature immune response takes at least 3 weeks from when you give that vaccine. Not all of these animals are going to be protected equally. It depends on a lot of things. We talked about genetics, nutrition, handling, etc. But always follow the vaccine withdrawal times. Your water-based vaccines, so your modified live ones that you'll have to mix up, those have a 21-day withdrawal. Your killed vaccines, which are oil-based, those are going to have a 60-day withdrawal. And remember that vaccines are not antimicrobials. Antimicrobials are your antibiotics, dewormers. They tend to treat or kill things. Vaccines don't. Vaccines, I guess, they challenge the immune system to build antibodies. A reminder: killed vaccines and toxoids. These are those oil-based vaccines. They tend to have minimal risk of abortion, but they can make these allergic reaction lumps on the side of the neck. You do need to generally have to have 2 initial doses to make sure you get a good enough immune response. But the immunity doesn't tend to last as long as your modified lives. The modified live vaccines are the ones that you mix up. So they have a diluent or a liquid that you mix with it's like a cake. Generally, you need one initial and a booster, but read the label to see what you need. This does have, in our adult cattle, it does have a higher risk of abortion. It can have a higher risk of abortion if you don't prime those, or if you don't use that vaccine in your cattle previously. But just reminding the two major types of vaccines. When do we vaccinate? Ideally, we're only vaccinating healthy animals, because if we have high stress or high stress means we have higher cortisol levels. The higher the cortisol levels, the lower our immune response is going to be. There is some evidence from Richardson, who is out of Texas. There is some evidence to wait to vaccinate at least 2 days and as long as 2 weeks after a stress event. So like vaccinating at weaning, not I guess it's the least recommended on my slide later, but even Dr. Richards, when I was talking to him this morning, he recommends like not vaccinating within or until at least 2 days after weaning, or after that stressful event, if you can help it. Vaccine protocols are going to be regionally dependent, but these are some common pathogens that people consider in our cattle vaccination programs. And so our respiratory pathogens, so like if we do a 4-way or a 5-way, generally includes a parainfluenza virus, IBR or infectious bovine rhinotracheitis, BVD, bovine viral diarrhea type 1 and 2, and bovine respiratory syncytial virus, which is BRSV. Other pathogens that you could consider: Clostridium, so 7 or 8-way. I put 7 or 8-way in here. This is another read the label exercise. Not all 7-ways and not all 8-ways are created equal. If you need tetanus in your vaccine, you need to read the label, because not all 8-ways will have that and not all 7-ways will have it. So just make sure you're reading, make sure you have the product that you want. I also, lepto apparently is something that is very common to give in your vaccine protocols in Hawaii due to all the rain that you get. It's generally not on the first round of vaccines, but it's on the booster side. So when we're developing our vaccine programs, and these are, there's wiggle room here. So again, work with your veterinarian on what's best for your operation. But ideally, we're giving that calf a vaccine before weaning. And so at that first processing or branding time, those animals are generally 2 to 4 months of age. That maternal antibody is going down and their immune system is building up. So we want to challenge that immune system to start developing antibodies. And that's when we're going to vaccinate. Boosters can be given a few weeks before weaning. And so that's where that timing and planning out your calendar plays into it. So when we do that booster before weaning, it really improves our immunity against pathogens, and it helps improve their response to stressful situations like weaning. The next best alternative, if you can't do that, is to give the initial vaccines before weaning, and then booster 2 weeks after weaning. Weaning time, vaccinating at weaning time is less desirable because does a stressed animal's immune system really function? And so if you're given a vaccine to a really stressed animal, are they really going to respond to it? The goal is to get a high level of immunity in and around weaning to decrease the risk of your calves getting sick during that stressful time. All right. I kind of threw these together because they didn't have they didn't have a home, so I put them together here. Internal parasites. Internal parasites can cause a number of problems, especially in our calves. Reduced appetite, anemia in some cases. They can cause subclinical disease. Back on our calf vaccination program, that's also when we can do an injectable. You can do some injectable deworming. Again, this is also something I'm gonna have you talk to your veterinarians about because I don't know what your parasite profile is in your areas. So just work with them on that. Um, Implants. I don't know how many of you implant your calves, but if you're able to in your marketing program, one, make sure you have the right one. The implant rules have changed a little bit over the past year, so make sure you have the right one for calves. But this increases feed efficiency, and it's a really cheap way to get an extra 20 to 25 pounds. And Dr. Tarpoff said, there's no such thing as a free lunch, but this is as close as you can get. If you are going to implant, make sure that you're doing it as cleanly as possible. So these pellets, I'll go back here. This implant gun has this needle where the pellets are in. This sponge has a dilute chlorhexidine solution. And so whoever is implanting is actually wiping that needle between every single needle touch. And so it's not just every animal, but if they happen to accidentally hit the needle on the side of the chute, they're going to wipe that needle again. And that decreases the risk of an abscess forming around that implant because if you abscess around that implant, then all the benefit is gone. So make sure you're doing that as cleanly as possible. We have directions in the manual and the field guide on how to do this. Foreign objects and remote delivery devices. I guess I'm just putting this out there because again, I didn't really know where else to put it in the presentation, but um, we, BQA recognizes that remote delivery devices or darts are being used to treat animals. I'm not going to go into a big discussion on this, but happy to answer questions later. But BQI recognizes that we can use these darts in emergency situations when chemical restraint is necessary for human or animal safety. We do not support the routine use of darts for treatment purposes. There's an if they are going to be used, we recommend that they're used in the BQA triangle. Route of administration, subcutaneous is preferred, and making sure that these animals who are treated with darts have clear identification to make sure that we're following residue violations or avoiding residue violations. Nutrition is a huge piece to our weaning and preconditioning programs. Nutrition, honestly, I probably should have put nutrition higher in my presentation because it's that important. Nutrition really supports that immune system. Those animals are growing. We need them to be growing. We need their immune system to be getting strengthened. Nutrition is just super key to everything that's happening in that calf. Everyone needs to have feed in front of them. Many of you might be doing creep feeding. That's a really easy way to get those calves used to pelleted feed, especially for calves that are going from the island to the mainland. They need to be bunk broke and water trough broke by the time they get on the boat anyway. So this is a way that you can start doing that. Stay on top of your mineral program. Dr. Richards told me he's actually looking into some copper and zinc deficiencies based on some of the mineral programs he's seeing in his practice, and he's still working on that. But I guess I'm just giving it to you, giving that information to you to pay attention to, and maybe talk to your veterinarian about just in case. Because if copper and zinc are really important in the immune response, and so if you're deficient in both of those, then you may not be, those calves may not be responding to vaccines appropriately. Macro minerals and micro minerals are really important. I am not a nutritionist. I have friends for that. So I would encourage you to find an extension specialist or a nutritionist that can help you with that. But it's more complicated than people would like to admit. But we want to make sure that these macro minerals and micro minerals are available, bioavailable in the forms that we need them. And we need them in the proper balance. If one is too high, um, maybe the animals aren't consuming the mineral very well because there's a one mineral's too high. So there's some issues that can come from not having a good mix. Make sure that your feed and water is clean. And I know that sounds basic, but sometimes we can get I guess we can get bit by assuming that things are okay. Uh, I live in, well, I just talked to a producer who had high sulfur in his water and they didn't know until they finally tested it because they kept getting sick cattle and they couldn't figure out why. But um, if you think you have an issue, feed and water testing and testing water quality is important. I encourage all of you to have a relationship with your a diagnostic lab. They're really great for answering questions if you have anything like that, and then work with the feedstuffs you have. That's also I don't know what feedstuffs you have out there, and I that's where the nutritionist comes into play. This is probably not what you were expecting out of a weaning and preconditioning lecture, but I do want to just touch base on culling and marketing decisions. And if there are calves that are falling behind for, whatever reason, maybe they're poor doers, maybe they had a broken leg or anything like that, um, I just want us to make sure that we're thinking about the welfare of those animals. Fitness for transport, we use body condition scoring as one way to determine if an animal should be transported or not. But if you have animals that are not like the other for a number of reasons, maybe euthanasia might be an option, delaying shipment if you have to treat it, or maybe alternative marketing. I know some people, if they have stragglers or one-offs that don't fit into the lot, they will maybe they keep them and feed them out for their family, or maybe they sell it to somebody else who might be filling a load or something like that. There's different ways that you can decide on what to do with those animals. One piece of training that I hope all of you are giving to your teams is euthanasia landmarks. These are new diagrams that BQA created to make sure we're trying to give you as many tools as possible to be in successful in euthanasia if you have to do it. These are also available in the manual and the field guide. So just another training tool that I want you to be aware of. BQA transportation, you guys do a lot of transportation. And I should have put a ship on here, but I didn't. I know Hawaiʻi Cattlemen's has some great information on guidance on preparing your animals before shipping. But I encourage you, if you haven't already seen that, which I'm sure you have, but I'd go check that out. But BQA transportation is also available if you want to get more education on that. So when we put all of these things together, I tried to have you like see the big picture of why weaning and preconditioning the weaning stage is so important. And there's a lot of things that can go right. There's a lot of things that can go wrong. And so some strategies that we think about with weaning, there's the different types of weaning that I think of. So abrupt weaning is when we call it off the truck weaning. It's complete separation of the calf and dam. There's no transition period. This tends to be the most stressful for both mom and baby. Uh, there's fence line weaning, which means we separate calves on one side of the fence, dams on one side of the fence, and you let them sit there for 7 to 14 days, and basically the calves and the cows eventually figure out that they can live without each other, but they're still in nose to nose contact, so it's not as stressful. Nose flaps are anti-suckling devices. Those What those do is it's basically it's almost like a nose ring in those calves. When they go to nurse, it pokes the mom and it discourages her from letting the calf nurse. And so some people really like those. That's one option. Other options, these are probably less known. Transient or nursing weaning. So transient weaning is similar to what we talked about with processing. So you separate that calf, like the day before processing, and you let it run through the system. That's actually that's what we mean by transient weaning. It's like a two-stage weaning where you do it a couple times and you just get those calves used to not being around their mom, and then that helps decrease the risk of or the stress of weaning. Nursing weaning is one that I saw a producer do who was doing a lot of embryo work. And so when he needed to set those animals up, like in their sync program or anything, they would let the calves nurse, and then they would separate the calves overnight with a creep feeder. And so at night is when they were setting the moms up for all of the embryo work and everything like that. And then in the mornings, they would let the calves come back to the cows. And they actually did that for about a week. And then by the time they actually weaned them, the calves didn't have an issue with it at all. So it was something that I had never seen before. So I've been sharing it with people. But weaning calves prior to shipping has been shown to reduce BRD even without vaccination. And the timing really depends on your operation. I heard from a number of the veterinarians that 30 days is kind of the like bare minimum of weaning. Well, especially for shipping calves to the mainland, 30 days was the minimum days between weaning and shipping that Dr. Richards and Dr. Conley recommended. This allows time for the boosters to work, and you get calves bunk and water trough broke, which is really important when they're on the ships. Preconditioning, as defined by NAHMS, which is the National Animal Health Monitoring System that USDA puts together, the definition that they have is weaning at least 45 days prior to selling, dehorned, castrated, at least one modified live vaccine, at least one clostridial vaccine, and potentially Mannheimia hemolytica. So that's a bacterial respiratory pathogen, dewormed, and then bunk broke and trough broke. A true preconditioning program requires more than just vaccines. So these are all the things that you can consider in your preconditioning program. Preconditioning improves animal welfare. It can it can improve health, maximize feed efficiency once those animals get to the backgrounder or the feed yard, decrease treatment costs, and then also add some premium pay to your bottom line. This figure here, so this is the number of times that animal was pulled. And so T1 is no health history, which means it was not preconditioned. T2 and T4 are both preconditioning protocols, and you can see that if the animal was not preconditioned or taken care of beforehand, it had a much higher percentage, or it had a higher risk of being pulled. So preconditioning does help. It does help a lot if it's done well. So is preconditioning for you? I threw this picture in from Canada just to throw you guys off. Is preconditioning for you? Do you have facilities? Do you have the time, the labor? Do you understand the cost benefits? Do you have a specific marketing opportunity? All of these are questions you should be asking yourself for a preconditioning program, but I think it has been proven that it's healthy. It's better for the calves if we can do it in the proper way. So in conclusion, I want you to consult your resource group. There are a lot of decisions that we talked about today that you all can be working on with your team, but I would encourage you to get, people off your farm, your extension agent, your veterinarian, your nutritionist. All of those folks can come in and be new eyes on your operation and ask questions and maybe help decide what are some tweaks we can do to your system to improve it just a little bit more. This your team can help you determine what the best weaning and preconditioning strategies are for you. And again, we're really trying to improve that animal health and welfare. But in the end, especially with prices that they are now, it's a really good business decision on keeping these cattle as healthy as possible. So we've talked a lot about we've talked a lot with this about different aspects of the BQA program, but we have really a lot of tools in the toolbox to keep our calves healthy and to make better and more improved decisions on how we take care of cattle. But a lot of it starts with those good management and husbandry practices, employee training, low stress handling, biosecurity, all these different things. I didn't even touch on genetics. You guys can, God, you could have an entire genetics talk based on how calves do. Nutrition, veterinary care, proper housing. The goal is to decrease stress, manage risk, and ultimately improve cattle health and welfare. But hopefully, I've given you some things to think about as you're going through your planning year, and at least giving you some talking points that you can with your resource group. So, with that, this is my email. Please email me if you have any questions or if I can connect you with anybody. But I am very grateful for the opportunity to talk to you and to throw you in the loop, throw you for a loop again. These are pictures from my trip to Alaska in August. So this is from the only dairy in Alaska that we got to visit. And this is one of the glaciers that we got to see in Kenai Fjords National Park, and then the grizzly bears in Katmai National Park. So give you some cold weather just because it's fun.
Thank you, Dr. Herman. I think that's some very good information there and things to think about. Remove that real quick. And so there was just a couple of questions I think I just answered in the chat just in regards to BQA and benefits of being BQA certified. I do want to introduce Dr. Caleb Reichart, who joined us a little bit after we started. He is the other project person here that's on the grant with us that's helping support some of the workshops and webinars and things that we've been putting on. But I'm gonna just look. I don't see any questions in the chat. Does anybody have any questions that you can either unmute yourself and ask, or if you don't want to, you can put it in the chat or in the Q&A, and we can answer some questions.
And what did I miss? I always ask this after I talk. Like, I mean, none of my lectures or my presentations are complete. So if there was something that I missed that you thought I was going to talk about, uh, tell me, and so I can improve that the next time I get this.
You hit probably a lot of things that I was thinking about as far as some of the cycles and I think practices and things that we have to consider here where we have animals that are going across the ocean and some that do stay here. So I don't know if everybody's very quiet.
I feel like if you guys are shipping cattle across the ocean, I feel like you almost have less room for error because that transport is so much more stressful than a lot of what, the calves here on the mainland are going for. And so I think getting the basics, getting the basics right, I think has even more importance to you all than it does. And I don't want to say that it's not important to other producers, but I think that's just one extra thing that you have to think about. And so planning ahead, making sure the timing is right, making sure all of those steps play up and I think it could, I mean, it's a lot to think about.
So I'm going to throw Caleb under the bus here, but he is, if you have any nutrition questions too, he is our
Yes.
our nutrition person, and I always reach out to him for things like that. We do have a question. What is the best way to sanitize the vaccine syringes? Boil water, or what is your recommendations for that?
The repeater syringes, Amy.
Or, yeah, that yeah.
Okay. So yeah, boiling water, what I generally like to do, as long as they're not super poopy on the outside. So no disinfectants or soaps should go inside of those repeater syringes. So yes, I do boiling water, sterile or distilled if you can. And basically, I just pull that water up into the syringe and squirt it on the ground. And I do that a few different times. And that's generally enough to clean those syringes. If you have to clean the outside of those, very dilute soap and make sure that everything is closed, like only clean the outside. Um, the other thing to think about, not just with repeater syringes, but those, I showed it with the lidocaine, but it's the syringe with the tubing. Those also need to be cleaned in between. And so hot water is really good for that. Uh, but I'll, they're in the manual, Melly.
Hmm.
There's two resources for cleaning syringes in the manual and the field guide. One is from University of Lincoln, Nebraska, and one is from the University of Wisconsin, Madison. But I could email those to you, and then you can email it out to everybody who registered.
Hmm. Yeah, for sure. And I will send on the email out with the link to the BQA resources to the
Oh,
field
perfect.
manuals and the field guides. And if anybody's ever done a BQA certification with us, we always give them a field guide. I always make sure that they have that. So if you've ever done one with us, you will have them. Or if you're going to be attending the BQA one on Maui, we should have them there too.
Great question.
Any other questions? I lost my Q&A box here. Hang on. I don't have anything in here and I don't have anything else in the chat. Caleb, did you have anything you wanted to add?
No, it was a really interesting talk. So thank you for staying up late and hanging out with us over here.
You're welcome.
Well,
We'll be in
thank
the
you,
same
everyone. Yeah.
we'll be in the same time zone soon.
Yeah. Yeah, so thank you everyone for joining us tonight. If there is no questions, then we will end tonight. You will get directed to a survey. If you could please fill that out for us, it really does help us improve our program. So thank you again, and this recording will be shared on the YouTube channel, which we'll share to everyone that registered as well. So thank you very much, and thank you, Dr. Herman, for joining us again. Really appreciate it.